Well, thank you to Kathy and the panel for bringing it home here. I want to thank all of our speakers, panelists, and moderators today for just a terrific job, a very stimulating set of presentations. I want to thank all the members of the Roundtable who were part of the planning of this, but also were part of the day here for your thoughts and insights and provocative questions. I want to thank the members of the public who are here with us, and also all of our virtual audience who have been with us throughout the day. And I would also especially like to thank Darla Thompson of the IOM staff, who was behind the organization and planning and execution of this entire workshop. So with that, I am pleased to turn it over to the co-chair of the Roundtable for some final thoughts and reflections. George Isham.
Thank you. Thank you. And it's, you know, Ray has turned it over to me, but I'm going to turn it over to the members of the Roundtable and others here to also join me in making those reflections. So I'd like you to be gathering your thoughts. I have been very impressed personally over the day with the level of conversation that we've had. It's opened for me personally a sense of a whole new depth and texture of the possibilities around private sector involvement and engagement around population health. And I must say I've learned as the day's gone along. I've been also delighted to see that several people during the course of the day have also confessed this very same thing, that this conversation has helped them learn as we've gone along. I think, and not to do anything near a complete summary, but I am very impressed with the fact that of this concept of that Ray has now repeated enough times over the course of the day that I'm actually internalizing this health in all practices sort of concept. I hope nothing today in the dialogue around from George Flores about policy has in any way shut down the fact that if health in all practices is an important opportunity and avenue for engagement of businesses, it's not in competition with or opposition to advocacy for policy and participation and support of policy. I thought the panel I moderated earlier in the day was very clear on that point. So I hope that isn't the takeaway from the day. It also occurs to me that if businesses are looking at this triple outcome of not only financial impact, but social and environmental impact, and that's being fed and nourished, if a bit, by Michael Porter at Harvard and other thinkers in the business community in terms of the social value of business. And Mark Weick has again shared with me a number of references to books and thinking about that and sustainability. If that's the case, then it seems to me that it's going to take the collective corpus of business in this country to come to that point of view. And I thought Vera was very clear in terms of her answer to the question in the last panel, that if that's going to happen, we're at the very beginning of that, the very tip of that. And we've seen, as we often do in our workshops, examples of exemplars who are leading, not necessarily the average or middle mass business community. So that represents an opportunity for the Roundtable in terms of asking the question of how our conversations and how our products, our intellectual products, if you will, what small role that we can take in fostering and moving the movement of the industry in that direction of that broader point of view. Because I think that broader point of view, if business sees as in its interest that it needs to behave in a way that takes into account these sort of outcomes of financial, social, and environmental, then it will see in its self-interest to advocate for policy, to make investments in the community, and so forth, to cooperate with public health, and so on. But to the extent that business is not aware, first of all, or not in that space, I'm not so sure that it will see that as in its interest. Because I think most of us think about that, the incentives in the way, and I think this was illustrated by a number of the examples we had, that it's very, very important to align self-interest and well-being of individuals, organizations, and so forth with collective good and social good as a strategy. So I think that's an important opportunity for us. It further reinforces, in my mind, the value of a multi-sectoral conversation. And as I've tried to formulate questions both from the podium and in the moderator role, but also at lunch and in the informal conversations I've had over the course of the day, it seems to me that a lot of the sectors are operating with different terminology and meanings and cultures and beliefs and values, even within this conversation. And I've often struggled, actually, how to formulate some of my questions so that I think that they're comprehensible to the people I'm talking to, if it's across a sector, for example, or if I'm going to use a word in the wrong kind of way. So again, I think there's an opportunity there for the roundtable to be thinking about that. I cannot in any way review at this point in time all of the things that I've learned. I've taken notes. I'm going to have to go back and really take a look at that. But those are a couple of thoughts that I would offer just to start the reflection part of this conversation going. It's important for us to reflect at the end of these conversations, not just to have heard the presentations and made the questions, but to reflect a little bit upon what we've learned and how it might be important for moving forward. So I would invite you at this point, particularly roundtable members, but also others in the audience, to engage in that activity right now so I can get on the record for this report. So the microphones are open. I am particularly interested in having someone come, and Dave, my co-chair,
is going to help you out.
Right? And always considering helping me out, not leaving me hanging. I really appreciate that.
So Dave Kindig from the University of Wisconsin and co-chair. So I had a couple of thoughts, several of which I'll repeat things that you just said, I think, maybe in a different way, but repetition has a value too. So let's see, in what order? I also took much more deeply the health in all practices idea. This may become a little phrase that we begin to promote. You know, as much as we see here how important it is for businesses to get outside of their workplace into the community. You know, the opportunities in the workplaces, in businesses and healthcare organizations as businesses. I mean, I thought we saw some great examples here. And of course, if every workplace did that, you'd have a lot of the population covered. So that's something really, I thought it was important, and I was heartened to see some of those examples, and I appreciate the leadership of those people here that are pushing on that. Second, so I read the Porter stuff when it first came out. I think that was back in 07 or 08 or something like that, and I noted it, but I kind of said, really? You know, I mean, the idea that sort of beyond social responsibility, I think that might have been the title of the article, the businesses actually would become a fundamental part of the business model. That, I mean, he even went so far as to say that for capitalism to survive, and that's where I raised my eyebrows, but you have to move beyond the traditional just straight profit model to this thing where you have to create value for society by addressing its deeper needs and values. And that was and I guess I'm heartened today to see that the concept is more alive in the conversation than I would have thought. Shared value phrase was used a lot of times, and we saw again some examples, albeit they may be at the beginning of the change process. Right now, may not everybody, where that may actually be happening. And so that would certainly be an important development for our field. And then finally, just want to reflect on something that you did, George. George wrote a paper where their organization, HealthPartners, took the county health rankings model and embraced it. But then they sort of looked at the 4 driver categories, those buckets of healthcare, behaviors, social environment, and the physical environment, and sort of they identified all of those as important to their outcomes of better health, the way we define it, but sort of looked at where they had particular capabilities and control. And of course, within a healthcare organization, they were strongest within healthcare, cost and quality, and with some degree in behaviors, but with limited control in the social and environmental factors, direct control. And so then he argues that then they need to form partnerships to help get that done, partly through policy, advocacy, and financing. But isn't it ironic that and we were once, as you recall, we were once going to do little diagrams like that for every sector, and that's one of a dozen things we've never gotten around to. But when in thinking about that from the business perspective, isn't it ironic that they actually, in many ways, have direct capabilities and control over the social and environmental determinants through employment practices, through some of the environmental responsibilities that we've heard today, and more limited. They still have indirect. It's the other way around. They have indirect power over healthcare costs and maybe some of the behaviors. And so this is just an irony that in the social determinants. Now, the difference, of course, is that HealthPartners had health improvement as its only or its primary mission, and corporations have broader missions that they work for as well. But I think it's really a lever that we can exploit in terms of those direct influences that we've seen illustrated today. Thank you.
Thank you for that. Appreciate that comment. And there's so many good ideas I've had with Dave Kindig that we have not brought to any level of fruition, and I'm glad that you're continuing to add that to our list of thoughts. Over here. Is that you, Tom?
Thomas Levis from Johns Hopkins and member of the Roundtable. So as I was listening to the presentations today, I started to reflect on a conversation I had some time ago with a colleague of mine who was working with the attorneys that was suing the tobacco industry. And he made a comment that was really interesting, that as he was observing these attorneys and how hard they worked, he was talking about saying, boy, if only we could harness the power of free enterprise for public health, as a public good, to improve the health of the population. And that stuck with me, and so it was really heartening to listen to these presentations today and see where people have actually taken that idea and are trying to do that. So I thought that was good. And I was really fascinated by some of the presentations that I saw today. But I do have 2 things that kind of sticking with me. As I'm having a hard time sort of thinking this through. And I was looking at some maps in light of what's been happening in my home city of Baltimore of late. I was looking at some maps that I have that depict redlining in Baltimore City. For those of you that may not know, redlining was a practice of systematically selecting communities to not be invested for non-investment. Went from the 1920s until about the 1970s. And as I'm listening to these presentations, I couldn't help but wonder, will it be enough? Will it be enough? Not so much will the interventions themselves have an impact, but will it be enough? If it took 60 years to create West Baltimore, will there be sufficient appetite to sustain this effort to overcome the impact of that 60 years of disinvestment? And so what is the model for sustainability? Are the incentives strong enough to keep business engaged long enough to really move the needle? And the other thing that comes to mind is that I found myself wishing that these interventions had been more explicitly sort of focused on health. In other words, looking specifically to see whether or not there is a health impact, not only on the individuals who get jobs, but in terms of the community, and collecting data systematically to see if population health had been improved. And so if one thing I'd love to see come out of this is some thought about this sustainability question, and also some thought about, engaging the public health sector from an evaluation standpoint, so that we can see whether or not we're actually improving population health. So.
It's a very thoughtful comment, Tom, and really a significant challenge, I think. To me, if I could just reflect again on what you said and add a little of my own personal comment, it seems to argue for a concept that's not a Pavlovian sort of incentive structure for businesses to do something, but more of a fundamental change in the conceptual thinking of those in the boardroom and the C-suite about the function and purpose of business in society in terms of how it's been talked about. Because I don't think you make social change on the scale that we're talking about that's resulted in some of the issues that you referred to in Baltimore, either lightly or easily or quickly, unfortunately, but they need to be fundamental in terms of the thinking of people in society. And in much the same way, many of the great movements that we've tried to look at in our movement workshop have been that sort of fundamental change. So thank you for raising that and making that comment. Right up here, Jose.
Jose Montero from Cheshire Medical Center, Dartmouth Hitchcock, and as well representing ASTO as an alumni. It has been an amazing day. Looking just at the title of this that doesn't have the word health on it has been quite an interesting conceptual development. We're talking about improving the economic well-being and community outcomes, which is in some respects somewhat we have defined as part of the population health concept. But looking at all of this development in businesses and some of the comments about how much do we want the businesses to be engaged in the policy discussion, they are by the nature of existence, but then they are by the nature of the power that they hold and the economical impact that they have. And when we look at population health and community outcomes and economic well-being, we're talking about policy that is related to politics, and politics that are related to policy, and things like Citizens United things come to mind. So businesses have a voice that is quite loud and powerful. It is great to see that engagement directed toward the measure of this triple aim of businesses. I am paraphrasing some other terminology, but the measuring of the social impact, the environmental impact, and the fiscal and financial impact is critical, that we see all of these as a consistent, unified system. When I look at the presentations from today, the gentleman from Detroit has 4 things. So you have to stabilize, you have to improve, you have to sustain, and you have to transform. And his horizon is 50 years, if I remember correctly. I hope that we don't have to wait 50 years for what we are trying to achieve, and that we have possibilities that will get us sooner to these aims that we are proposing. But what I didn't got that clear today is how are we measuring the impact of all of these different things, and how are we tying them to what we do? Health outcomes, measures as the absence of disease or as other things. How do we connect all of these dots so we can go back to our funders, payers, or our own systems to show how are we making these big changes happen, and how soon we can get there, and help us improve this economic language use in people in our type of institutions. We are not good at packaging these products. Ian, And was talking this morning about, well, you need to do these projects and all of this social investment. I have no idea how to package one of those. I have no idea really how to design it. I have an idea of what it should be. But where do we get that expertise, and how do we take the lessons learned from all this process and use the Roundtable vehicle to advance that agenda that will help us to actually be able to measure the social, environmental, and financial impact of all of what we do, but then at the same time develop in scales that are useful for places all across the country. So we have big businesses here today, but this country is privately employed in smaller businesses. How do we engage at the level of the 15, 20, 50 employees? How do we provide for them the technical assistance and the know-how so their CEOs know the role and can tie into all of these efforts? Many questions, many things that came up to mind. Still, great session. I will love to see how we move forward with these further developments.
Yeah, thank you for that helpful thought. And I just want to remind us that in the end of July, we're going to be looking at measuring impacts. And I hope we catch the sense of your comment related to this conversation as we have that discussion in July around measuring impacts. I'm not sure who's come to the microphone in what order, so we'll just go back and forth here.
Sure. Bobby Milstein, Rethink Health, and a member of the Roundtable. You had asked us at the beginning of the day, George, what we were expecting, and did we get something very different? And at least for me, I was struck by the scale and ambition of these efforts. I mean, here, just looking at this, we've heard stories about attempts and serious attempts to change whole generations with the Partnership for Healthier America, whole sectors with healthcare without harm, whole cities, as the story in Detroit, the sort of entrenched inequities in Hope, San Francisco, and in Dow, I think it's not too far to say whole planetary kind of ambition. So I really wasn't expecting to hear all that, and it was a reminder that long before Porter, there was a sort of a rogue economic theory that says great wealth flows to different actors through economic transitions. Moving from agriculture to the industrial age, there was the wealth flowed to those that built out the infrastructure for manufacturing and transportation. In the move from a manufacturing economy to an information economy, you see great wealth flowing to the IT and sort of service sector. And the theory was that with so many problems becoming more and more entrenched, there would become the transformation economy, where great wealth flows to those entities that solve problems. And I think there's reason to believe that these stories we're hearing today are at least attempts to try to take a stand toward a transformation economy. What is striking is just how far out of the mainstream these examples are from the the survey we just heard, and if we really look at the mainstream. And so I think the question practically for us as a roundtable and us as leaders is, how do we use these kinds of exemplars effectively, and how do people learn practical lessons across fields and sectors where what Dow has done, or any one of these exemplars here has done, can actually be used to draw more people into this work and make it their own. And I'm not sure I have an answer to that, but it seems that we ought to stop using the word private for what this is. There's nothing private about it. It has massive public influence, and it's also public in the sense of being much more transparent about why these groups are doing this work and how. And also public in the sense that it needs more people to support it and to do it well. It is public work, and the word private is an absolute misnomer. So I will stop there.
Yeah, I thank you for that. Again, another very astute comment. And I must confess, Bobby, that I've had similar thoughts, and then reflecting over the course of the day, the fact that we live at a time in the middle of information kind of revolution and change in our both social and organizational and institutional structures in society. And I've really begun to think about how that relates to our concept of nation states versus these international sorts of flows of commerce and economic value, and how that'll change institutions and responsibilities for some of these social and environmental outcomes that we care so much about. And I don't know where that goes or whether it goes any place positive, but that kind of thought has occurred to me as well. Michelle?
So I'm Michelle Larkin with the Robert Wood Johnson Foundation, a member of the Roundtable, and it's been a great day, so thank you, Ray, and to all of the committee who put it together and the speakers. It's been really engaging and sparked a lot of thought for me in terms of the work that the Robert Wood Johnson Foundation is doing. A lot of it for me stemmed around collaboration and coordination. I think oftentimes we talk about what the private sector or business can do for advancing health, but what we fail to do sometimes in the population health sector is think about how we can be helpful to business in terms of accomplishing their goals and their objectives. And I think what I heard today is that we're being much more thoughtful about how that collaboration between sectors is actually creating a value. The other place where I heard a lot of themes around coordination and collaboration were also for businesses engaging their employees. And so it wasn't a top-down approach, it was also the employees and community members coming together to talk about what they wanted for the health of their community, what they wanted for the vibrancy and vitality of their community, and the health and well-being. So I really appreciated the speaker's comments about that, because I do think this is how we empower and set up those opportunities for communities to be more healthy and have a much more robust economy than many of them are afforded at this point. The other thing that I wanted to mention, and Jose stepped out, but he was a great setup for my comment, because one of the things that I wanted to make sure folks were aware of, which goes to his comment and to some instance Bobby's, around the size of the businesses that we have here today. They are large, they are influencers in the field, and in many respects have been champions for incorporating population health, health in all policies, and healthy practices. But one of the things that the foundation, the Robert Wood Johnson Foundation, embarked on most recently is actually with the Chamber of Commerce Foundation, a campaign called Better Health Through Economic Opportunity, which is an investment to engage the chambers from across the country, all size businesses, sizes, shapes, mom and pops to large industries, to really think through what tools are needed for them to really be able to explore health and how that helps them advance their goals within their communities. So those tools, and also to do some more research around the link between health and economic opportunity and growth and development, which I think will be critical to advancing the conversation that we started here today. And lastly, around measures, I couldn't agree more that we need to do some work on measures, both measuring the contribution that the private sector makes to health in our nation, but also moving beyond just the return on investment. I heard that come through several times today, that it's not just about cost savings or the financial gains, but it really is about how we actually capture the value of a vibrant economy and those partnerships, the collaborations, and the coordination between business and the population health sector, as well as community development and housing and transportation, and really figuring out a better way to capture the value of that to both individuals and their families and their communities. So thank you all for coming today.
Thank you, Michelle, for that comment. And your last comment just reminds me that, at least from what I know of the business literature, and I'm no expert in it, but there are a number of business thinkers that think of that return on investment as far beyond financial returns, but returns that have to do in terms of a social mission and other aspects of what they do. Right over here, I have trouble seeing exactly with this light, but is that George Flores over there?
Yes, it is. It's George Flores from the California Endowment and a member of the Roundtable. Partly on what Michelle just said about the employees, but taking a lesson from the Lorax, who speaks for the trees, who speaks for business, we've all accepted that it is the C-suite that speaks for business, or the owners, and actually trade unions also speak for business to a great extent. And in fact, a much more egalitarian point of view, and who they represent on a political spectrum, and what they do in terms of community action and activity in terms of change and alignment with the interests of population health that we're finding in California anyway, is very highly aligned with our value systems, and in fact are there. Trade unions are there consistently in front of policy bodies, in front of progressive change for improving health, improving education, improving opportunities for communities to get healthier and be better off. So we can't forget that what represents business may be another voice and another point of view that really can be mobilized. And in terms of opportunities for partnership, certainly opportunity for partnership exists there through the voice of employees and organized labor.
Thank you for that reminder, George. Really appreciate that. Over here to Sandy.
Sandy Magnan, member of the Roundtable. So I guess I wasn't expecting to walk away with more hope today, or to hear the word hope used in a number of presentations. And even when the gentleman from Detroit was asked about how he persevered through despair, and you know, just the hopefulness that a number of our speakers had. And when I think about what we, with working on population health and thinking about rising healthcare costs, the outcomes that we don't get as a country, the inequality that exists, the number of times that I heard hope mentioned, a kind of an expectation or desire for something different. And I also heard that how could the IOM help? And just that using our position for legitimizing that businesses and working on economic well-being was important. Being able to elevate that in our national conversation, to be able to tell stories like we've been doing here today, to legitimize that more. The other thing that I really heard was this part, particularly that was happening in Detroit also, about the civic engagement and that sustainability, and what part does that play that we really haven't gotten into other than talking about social movements, but this more civic engagement. It just gave me, I wanted to ask him more about that. How is he sustaining that, and how is that contributing? So anyway, those are my thoughts.
Thank you very much, Sandy. Pamela.
Thanks, George. It's Pamela Russo from the Robert Wood Johnson Foundation, also a member of the Roundtable. And I found this an incredibly educational session, and it wasn't what I expected to come to. And like Sandy, I heard some real beacons of hope. The things that were interesting to me was well, I wanted to echo Kathy's comment when she said we got both information about what businesses are doing, can do, practices, policies, work in the community, education and employment. But we also got that heavy dose of taking a business approach to thinking, like as in Ian Galloway's presentation, to really understand what it takes to do an investment and have this complicated thing in order to achieve those health aims. So I agree with her. We got it from a couple of different angles, and that was really valuable. A second point, though, some of the businesses, I mean, Ray from Kaiser and Dan from Detroit and Gary from Healthcare Without Harm, and certainly Dow, talked about sustainability. Sustainability was a huge part of their sense of social good and impact, where that wasn't always true in all of the other examples. And so I think we just have to think more about that. What is the sustainability part of population health? I was curious because I read some of the background articles, and there was this terrific one, again, from the Stanford Social Innovation Review that you sent us by Hollander, I think it is, Hollander. He talks about net positive. So we've got shared value, we've got net positive, we've got collective impact, we've got different terms, but his net positive is basically that a business does more good than it does harm. So it comes back sort of to your Hippocratic thing. But it really talks about both environment and social impact. to Tom's comment, I realized that whenever anybody talked about employment or education here and didn't think it was health, I've found that amusing because I've so totally absorbed the idea that improving education or improving employment means better health. But Tom says, no, well, what about those other health status measures? Can you really show, can you also go and track those and see that you've had that impact in a community? And it makes me think about Raj Chetty's work on income, or on upward mobility and mortality. And so that work basically, does that county analysis and shows that in places where there isn't upward mortality, there's also a much higher premature mortality. But we can't move everybody. And so I think today we heard a lot of terrific examples about how within a community you could change that upward mobility trajectory by the combination of business and all. My last comment is just, I'm always struck by it. I'm so glad that Ann talked about the health department because I didn't hear businesses talk about thinking that the health departments were potential partners to work with, or I heard about other community-based groups, but not the health departments. But thanks, Ann. Thank
you, Pamela. And of course, I can't resist adding to your observation about that some of the conversation was about these other social goods, but not talking about them as health. And I'm reminded that I had the privilege of chairing a committee for the Institute of Medicine, a short report on State of the USA measures, which envisioned health as only one of a number of key outcomes to measure the state of the U.S. I still think there's merit in that idea, although it wasn't funded and hasn't gone anywhere. And I know David Kindig was on the committee, but the advantage to that is that much in the way that we found in the health and all policy discussion, that it was somewhat off-putting to use health and all policies with the other sectors. It's somewhat useful to recognize that health is one of the very important social outcomes, but only one of a number of important social outcomes as we think about the determinants of health as being sort of the determinants of the well-being of the nation or something. So I can't resist adding that comment, so I hope you'll indulge me. Mary Lou.
I'm Mary Lou Gakey with United Way of Santa Cruz County, California, and a member of the Roundtable. It truly was inspirational today to hear all these companies that are really delivering on the triple bottom line, and I took a lot of hope as well from that. But I had to contrast it with a conversation I had just yesterday morning with the manufacturer of a well-known organic snack food company. And this is a company that does everything right, pay a living wage, built a park in an impoverished neighborhood, very generous in the community, really, really an example of a good corporation doing good for the company and the environment. And they're almost being driven out of business by companies in Nevada and other states that don't pay living wages, don't care about the environment, and the product is more valued by the buyers of these high-end grocery stores and box stores than the man who does the good thing. So it makes me want to think, what can we do in the public policy arena and in the consumer education arena to say, let's all value that snack food that did good all the way around and not just always go for the lowest cost product. So I think it's something we should give a little bit more thought to. How do we encourage more companies to really be good in all directions?
Thanks, Mary Lou. And if the camera on the webcam was on me while she was asking her question, then everybody across the nation could see that I was kind of goading Ray to make any other observation he might before we close. So, Ray?
I think the reflection I had throughout the course of the day was that I was quite surprised, even though I was part of the group organizing the panels and selecting people to be honored, at the range of approaches that were described here. And so in that respect, I think we probably came close to succeeding on our objective of, can we just display the enormous range of approaches and levers that business can pull as a force for good. That said, we were hearing from exemplars by definition in this. And I think that we need to give a lot of thought to where having seen what can happen isn't the same as saying we should only rely on voluntary action by businesses that choose to engage in population health. I hear it the other way, which is look at the levers that could be pulled if all businesses were operating by a code of conduct or a motivation or the threat of regulation or whatever the particular forces were, or simply a consciousness that they are part of society, not separate from society. But I still was thrilled at some of the presentations and also responded to the scope of some of the activities, in particular the Detroit example. If we only gave a megaphone to that story, we would be doing something, I think, to educate a lot of people about what the possibilities were and the fact that you can have great ambition and really engage people and businesses and the public sector and others in taking those things on. So thanks to everybody who was part of this.
And thank you, Ray, for that comment, and very, very thoughtful. And I think typical of Ray's leadership in terms of putting this together. And again, that comment gives me an opportunity to thank you specifically for leading the planning committee, putting together this day. And it gives me an opportunity to make one last reflection. I'd like to be optimistic. I am an optimist in many ways. And I'd like to think that the magnitude of the sort of change we may be hinting at, hoping for, seeing some glimpses of, is of such a magnitude that it will take a lot longer than we think it should, but will have a much bigger impact than we could even imagine. And I think that sort of engagement of multiple sectors not only applies to this sector that's the subject of this conversation, but I'd like it to see it apply to all of the sectors we're talking about: healthcare delivery, public health, education, transportation, so on down the list. So with that, I'll add to Ray's thanks that he gave earlier. Thanks to the whole planning committee under his leadership. Thanks in particular to Darla Thompson. This is just a terrific, wherever you are, I can't see you in the lights, up there in the corner. Thank you, Alina Batchu, and the rest of the IOM crew. Really appreciate that. And thanks to those who took their time to prepare and present. This has been an outstanding day in terms, and the quality of those presentations has been absolutely contributory to that result. Those who moderated the panels, thank you for doing that. Members of the Roundtable, for your thoughtful comments, and those of you from those others of you who have chosen to be with us today. It's been a very vital day. So with that, unless Alina tells me I'm forgetting something, I think we will adjourn with, I think, a very good day under our belt. So thank you all very much.